welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're going to be talking about calcium channel blockers, or CCBs for short. Okay, we're going to start with a question. How do calcium channel blockers affect the smooth muscle of coronary and peripheral arteries? If you're unable to answer the question right now, stay tuned to the end of the video and see if you can answer it then, alongside a few other questions. Alright, let's dive right in. What are calcium channel blockers? Calcium channel blockers are a group of medications primarily used to treat heart and blood vessel conditions by limiting a cell's ability to use calcium. These heart conditions include high blood pressure, irregular heart rhythms, angina, and coronary artery spasms. So, how do calcium channel blockers actually work? When we think of calcium, we might just think of strong bones. But calcium is actually an important electrolyte used for muscle contraction. So, just as the name suggests, calcium channel blockers block the channels the calcium used to enter muscle cells, which then limits the amount of calcium available for contraction, and then that leads to muscle relaxation. Now, there are basically three places calcium channel blockers can work. The first is the blood vessels. In the blood vessels, that relaxation due to the limited calcium helps loosen up the peripheral arteries, which decreases the resistance the heart has to pump against. Think of it like going from a garden hose to a fire hose. This can help with hypertension and improve blood flow to the heart. The second place is the heart muscle itself. By reducing the amount of calcium available, it reduces the force of contraction of the heart, which in turn decreases the oxygen demand the heart needs. And that helps with angina. And then lastly, it can work on the nodal cells. The nodal cells are basically your heart's natural pacemaker, the ones that send electrical signal through your heart telling it to beat. By reducing calcium influx, those electrical impulses slow down, which lowers the heart rate. This makes calcium channel blockers useful in treating irregular heart rhythms. Now, let's look at the types of calcium channel blockers. First, we have the dihydropyridines. An example would be amlodipine. These primarily affect the blood vessels, and their names typically end in pine. The second is the non-dihydropyridines. An example is diazoxide. This primarily affects the nodal tissues, making them more useful for treating irregular heart rhythms. Okay, now let's talk about side effects and what to watch for. Some common side effects include dizziness, low blood pressure, slow heart rate, and peripheral edema. If we tie these back to how the drug works, it makes a lot of sense. The relaxation of the arteries and the reduced force of contraction can lower blood pressure, which can cause dizziness. That decreased blood pressure can also cause blood to pool in the peripheral limbs, leading to swelling in the lower legs and ankles. And the slowed heart rate comes from the drug's effect on those nodal cells. Now, what are some important precautions to watch for? The first is heart failure with a reduced ejection fraction. In this condition, the heart is already too weak to contract and pump enough blood. So imagine giving a calcium channel blocker that reduces the force of contraction even further. That's why we use caution with calcium channel blockers in this population. The second precaution is second or third degree heart block. Why? Because electrical conduction is already significantly slowed in this condition, and we don't want to slow it down any further by giving a calcium channel blocker. Alright, now let's talk about nursing management. The things we want to monitor for and teach our patients. We want to make sure we're monitoring blood pressure and EKG changes while a patient is on calcium channel blockers. If the blood pressure is low, typically less than 90 systolic, we want to hold the medication. We also want to monitor for side effects like swelling and dizziness, and teach our patients to rise slowly when getting up from bed. One more important thing to watch for is grapefruit juice. When patients are taking CCBs, we want to make sure they're not taking the medication alongside grapefruit juice, as it can interact with the drug and raise the medication levels in the blood. Okay, so now that we've covered calcium channel blockers, let's dive into some review questions and see how much you've learned. First question: why is heart failure with a reduced ejection fraction considered a critical precaution for the administration of calcium channel blockers? I'll give you a moment to think about it. The answer is that the drug further reduces the force of contraction of the heart, which is a critical precaution. Second question: a nurse is reviewing a patient's diet and notices they frequently consume grapefruit juice. Why is that a concern for someone taking calcium channel blockers? The answer is that it can lead to dangerously high concentrations of the drug in the blood. Third question: a patient taking nifedipine reports swelling near the ankles, which is worse at the end of the day. This symptom is most consistent with which side effect? If you said peripheral edema, that is correct. Fourth question: which underlying condition would lead a nurse to question a new prescription for calcium channel blockers due to the risks of stopping electrical conduction entirely? The answer is third-degree heart block. And the last question: what is the rationale behind instructing patients to change position slowly while taking this medication? The answer is to prevent dizziness caused by sudden drops in blood pressure. Now, go back to the beginning of the video and see if you can answer the very first question. Let me know in the comment how many questions you got right. If you found this video helpful, please like and subscribe, and I'll see you in the next one. Thank you.